So, if hospitals are trying to implement similar methods, what is your best advice for them to become more sustainable facility?
Sure. So that's a great question because I've been getting a lot of phone calls, literally um, every week. I just spoke to someone, a COO from Virginia, about the same issues. And what we're seeing is a lot of hospitals, not only in the United States, but all over the world, really coming around to this issue. They're starting to hear it from everywhere, every direction, from television to magazines to their peers to the nurses on the ground saying, when are we going to do something about all the waste that we do? What's really wonderful is you're starting to see that and it's starting to percolate. The challenge is that each hospital has its own journey. We at this hospital started differently than Longmont United started, or Rose Medical, or Children's Hospital. They all start in a different journey. So the challenge is that what we do here at BCH might not be applicable because of whatever reason out in the Eastern Plains or the Western Slopes or wherever. So that they have to realize is that although people are doing it, it really is your journey because your hospital is so unique to any other hospital. The culture, what you do, the personnel, how things work. So you have to recognize that. The advice that I give people is, first of all, given that, is to look around, see who else is doing it, go to their hospital, ask them, come visit me at this hospital, ask about what we do, how we do it, where we do it, get ideas, research, look, think, ideas. You really need the support of not only your personnel, which I think most hospitals, the personnel will say it's about time we do something like this, but you really need support from above. This cannot be something that you kind of throw into committee and hope that they can figure it out. This is like any other issue in a hospital. You have to have, I believe, someone at the helm, like a sustainability coordinator, whether that's full-time or part-time, preferably someone who has worked in your hospital, who understands this, but also has really the passion for this work, who understands how to work from the outside, the inside, who understands the environmental world, who understands the hospital world, but is very committed to this. This is not a job for me. And for the most of my peers who do this, this is not a job. This is not a paycheck. This is really a calling. This is really something that we believe in strongly. And the fact that they pay us is just that much better. We'd love to be paid more, of course, but so you need someone at the helm. I believe you need to have some sort of environmental statement, if you will, something that the hospital says, listen, we understand our commitment to our community, we understand the effects of environment and health, and we as a hospital are going to do everything we can to do this. And it could be vague or it could be specific, but to have some sort of guiding principles so it sets the tone in your hospital that says, we're committed to this. This is not something that we're going to do for 1 year and then this is a long-term journey. Assessing your situation, assessing your waste, assessing your usage of water, assessing your electrical uses, assessing everything about your output or input in regards to your operations. You should be assessing to figure out, what are we doing? What's the impact of all of this? Obviously, a budget for that sustainability coordinator, I think, is warranted. It's needed, and as I've proved and others have proved, we actually save the hospital money. But to fundamentally to acknowledge, and this is just from me, others might differ, but I really hope that people acknowledge this idea of this is our moral obligation. This is not something that's just nice, would be great for PR, or it makes us feel good. This is about who we are fundamentally as a medical industry. And if you put that in those perspectives, like this is what we have to do. This is not something that we would like to do or we should do or might do. Or this is something we have to do because we are a medical institution that has to deal with health care. I think from there your journey will begin, and you will start slowly and you'll build upon your successes and you'll go down avenues and you might have some wins and losses, but you have to have a commitment of a long-term 10, 20. I don't know where this sustainability journey is going to go, but what I can tell you is from all of my travels, all of my discussions with folks from all over the medical industry, I mean from CEOs to manufacturers to bureaucrats to hospital folks, we're at a place in the medical industry that if we don't adopt sustainable practices, I am not quite sure how we're going to be able to maintain the quality of service that we can provide today, especially when you're talking about the rest of the world wanting this quality of service in their own backyard, Brazil, Russia, China, India, and those resources that need, again, I mentioned earlier, we're resource intensive. And so we can't sustain that. And then of course we're talking about, health care for everyone, health care insurance. When Massachusetts, it's my understanding when Massachusetts went to health insurance for everybody, the healthcare industry was severely used in some respects, because now that someone has health insurance, they're like, well, the chronic pain that I've had, now I'm going to go see a doctor. I have the way to pay for it because we have insurance. Well, that puts a real strain on the hospital because we're not prepared for the influx of folks who are sick but don't have insurance because they don't want to come into a hospital. So we have to look at sustainable practice to ensure that we can maintain this quality of practice for generations. I don't think anyone believes that we can maintain the level of resources that we're consuming on a daily basis here in this industry and assume that we can do this forever.
Yeah.
There's not enough worlds, there's not enough material out there to maintain that. So sustainability is really the only, I believe, the key toward ensuring that we can operate in a sound fashion, in a healthy fashion going forward. So it's not something that is going to go away anytime soon.
Thank you.
Mm-hmm.
It sounds like you're very obviously passionate about what you do.
Mm-hmm.
And do you have any words of wisdom, lastly, for those that want to be involved in sustainability and making sure that hospitals, industry makes the transition to
Mm-hmm.
be more sustainable and that we can use our resources instead of deplete them? I know it's a big question.
Yeah, it's a big question. I don't know if I have any words of wisdom. I mean, I just do the work that I do, but I will say, it has been so much fun doing this work. I think people are so supportive. I can't tell you, I get people all the time appreciating the work I've done. And to be honest, I just do the work. It's not, I do the work and I get and it's just a great position to be in. If you have any inclination toward the healthcare industry and you have a passion for sustainability, now is the time, because now is when people who are pioneers, people who are sort of out in front, are in this right now. We're sort of creating what the sustainability path will look like, and this is an exciting time to get into this field right now. But more importantly, I think it really boils down to is the words of wisdom is we have to understand our consequences of the decisions that we make. I don't mean just that in the hospital, I mean in general, as people, in general. When you buy something, when you use something, what are the consequences of that? And then when you make that decision to purchase it, then that's fine. But the time is now. We've just hired a new commander-in-chief, and I think the winds of change are at our back, and I only see really positive things coming out of this, and I only see an industry that's going to even get better and better, and really provide for the needs of our communities. And it's just a great opportunity. It's a great industry. I love this industry. It's just filled with such wonderful people, and to help them become even a better industry is just, you can't ask for a better job at all. So I don't know if that's words of wisdom or just my thoughts, but
Thank you, Kai.
you're welcome.